All right, guys, part 2 here. Thanks for hanging in here and doing this in 2 different sections. The file is too big to do all in one. A new and exciting thing for the controlled substance database is that they now have a scorecard for providers. And what that means is that you can look at your ranking, and the ranking is based on how many controlled substances you prescribe and see where you fall compared to other providers. Of course, it doesn't show you, other providers' names or anything like that. It just shows where you fall. It's also easy to find patient information now. The information that you need to find their controlled substance record is their name and date of birth. And if you have 2 patients, or if there are 2 patients in the system with the same name and the same date of birth, then you can also add in their address. So a question that comes up a lot is, can I prescribe a controlled substance without an office visit? So maybe you have an established patient who you prescribed pain medication a month ago. Now they need more. Can you prescribe prescription to them like over the phone? And this gets really tricky. And I can tell you that at the spine clinic where I worked at, we would do it if we had seen them within 24 hours. And that's like if I saw them on Monday, they didn't feel like they needed anything for pain. Tuesday, they call back in and they feel like, man, I made a mistake. I actually do need something. I could prescribe something over the phone for that patient. However, if it was something like, I saw you on Monday, I gave you Percocet, and now you're saying that that's not working for you, you need something different, then you have to come into the clinic for that. So the 24-hour rule was there, but again, it was still unique to each patient and the situation. I can tell you the information on the slide now comes from the treatment guidelines for pain, and then also from the state of Utah. So a controlled substance state should only be prescribed or administered based upon a thorough examination and evaluation for a medical condition. In order to write a controlled substance, an examination must be performed and diagnosis must be made regarding the justification for the prescription. It does not give you a time frame on there. That is up for you to decide with your own comfort level, and then also based on the policies of your clinic. What Doppel wants charted each time before you prescribe any sort of controlled substance is history, physical exam, diagnostic information, evaluation, treatment objectives, risks and benefits, informed consent, treatment medications, instructions, agreements, and periodic reviews, which we're going to talk about here in a second. So I can tell you now that working in student health services, I would never prescribe a controlled substance to anybody unless I had seen them that day. But I also have the luxury of that in this clinic setting. So periodic review. Periodic review is a recommendation from Doppel that if you are prescribing controlled substances to a patient routinely or monthly for chronic conditions, that you should have one of your peers evaluate the patient and or look at their chart every 3 to 6 months. I love this idea because I do think that as you build connections to your patients, that sometimes you are a little bit blinded maybe to seeing like red flag behavior, and it's just nice to have another provider looking in at the patient to make sure that you're on track and that the patient's on track and that they don't see anything alarming. So the model guidelines for use of controlled substances for the treatment of pain is published by the Federation of State Medical Boards. It's a really large document, and I don't expect anybody to read it, but that's where most of the information came for this PowerPoint, and also where Doppel gets its recommendations for then giving information to providers and also for managing their controlled substance database. So database gone wrong. This is a story about a problem that happened in Cottonwood Heights, and I want to share it with you. The story is that there was missing medications from the ambulance, and the medications were controlled substances. The police was notified, and as part of their investigation, the police department decided that they were going to check the controlled substance database records for all of the employees that potentially had access to this ambulance where the medications had gone missing from. So they checked over 100 people's controlled substance database records, and they found 2 that they felt like were suspicious, and those 2 people then became the suspects of the investigation. both of the two suspects were eventually cleared. They had legitimate reasons why they were receiving pain medications. They had the documentation and the support from their providers saying that it was legitimate. But unfortunately, the damage had been done. And they had a period of time where, excuse me, they had a period of time where they were put on leave without pay. And ultimately, they were both giving their jobs back, but they decided not to take them because they felt like their reputation had been tarnished and that people would lose confidence in them, in their position, and that they could no longer do their job there. For one of the people that was made a suspect based off of his controlled substance database, he and his wife were pursuing an international adoption, and because of the investigation against him and the claims against him, he and his wife were not able to pursue the adoption. And this happened in 2013. I don't know what happened with the adoption now, but you can, clearly see that this was devastating to these people and really kind of ruined their lives. They did file a suit against the police department, and they were found, and they won the suit, and the police department was fined $5,000 per person that they had looked at their controlled substance database. So for every person that they had checked, they got fined $5,000 for looking at their controlled substance database record unjustified. And that's changed things for us now. Now, the police department still has access to the controlled substance database. However, they are not allowed to look at it unless they have a warrant to look at it. So I want to talk briefly about tolerance versus addiction. Tolerance is going to happen to most patients, and it can happen quickly. Within a couple of days, people can build up a tolerance to medication. Of course, it varies between people and also what type of medication it is, but tolerance is when people are needing more of the same medication to get the same benefit that they got before, and it's not necessarily an addiction. Again, most people will build up a tolerance to the medication. That's normal. That's the body doing what it's supposed to do. But addiction is different. So some other tools to keep you safe and your patients safe and your practice safe and your license safe. So I think everyone should have a pain contract with patients who are getting routine medication from a provider. And the pain contract will vary depending on your office. They should have this in place for you. It's not something that you have to create, but it should include two things. One is that the person is going to commit to getting controlled substances through one clinic and one clinic only, and that's your clinic. And I like it to say clinic versus just one provider, because if you job share a position or if you're out and the person sees another provider, then it covers them. The second thing is that they should only get prescriptions filled at the exact same pharmacy every single time. The second tool to help protect us is to do random and routine drug screenings for patients. So I would love to hear any questions or comments that you guys have. I will open up a discussion board on this, and please give your thoughts and questions. So I just want to end this by telling you one thing that I'm sharing with permission from my husband, but I feel really passionate about the controlled substance database because my husband has had a problem with pain medications. In 2015, he admitted to me that he had an addiction problem, and it had been ongoing for over a year. He'd had a surgery where he did need pain medication management, and while I thought that he was improving, he wasn't, and he was still getting continued medications. And part of the problem that he had, or that kind of made his problem even worse, was that he was getting prescriptions from two different providers at two different clinics. And while I put 100% of the blame in my husband, I can't lie by saying I don't have a little bit of resentment towards the providers who just didn't check the controlled substance database, because I do feel like if they had looked at that, maybe his problem could have, he could have received help earlier. So that's the easy stuff to say. The hard stuff is to tell you how devastating this was to our family. And when it happened, my husband went into an inpatient rehab for 3 months. And I decided, after trying to stay working at the spine clinic, I decided that I couldn't do it because I felt like just so much had changed for me. I couldn't see people the same way. And so I decided to quit my job at the pain clinic. And I did that, one, because I felt like I couldn't provide treatment well anymore. And then second, I felt like I needed to stay home with my family and keep my family together during this time. And for 1 full year, my life and our family's life was really dictated around my husband's recovery. And it was a full-time job attending meetings. And then also for me, it was babysitting him, which I now no longer do and didn't do for very long because I realized that I can't do that. But still, we live and breathe recovery for him. My husband still attends weekly meetings. I still attend support person meetings. And it has instilled in me this perpetual fear that really never goes away. And I look back on that time and, especially that year afterwards, and I just can't even believe that I survived it. And it makes me tear up every time I think about it because it was just so difficult for our family. And it's something, again, that continues to provide some uncomfortableness and some bad feelings for us moving forward. And I just fear every time my husband gets sick or injured or potentially needs any type of treatment, because I don't want him to go down that path again. I'm proud to say that he's still in recovery, and things are much better now, but it takes work, and we still work on it all the time. Having said that, I have to say the flip side of it, which is there are also very legitimate reasons why you should prescribe pain medication to people and controlled substances to people. So do not be afraid to prescribe to them. There are people that need it, and it is our job to treat them. But please, please, please use all the tools available to you. And the controlled substance database is one of those tools. And I implore you to please remember to check it every single time, and don't get lax about it. Check it every single time and use the tools that you have available to you to be safe prescribers and to protect your patients and to protect their families. Thank you so much for your time, you guys. Let me know if you have any questions. Bye.